Great. Thank you for joining us. We're going to go ahead and get started. It is 11 o'clock. So thank you for calling in today and wanting to learn more about the PRPen, which is a new microneedling device that Youthful Skin is and Advanced Dermal Sciences is offering. So let me tell you a little bit about this technology here. So it's a new microneedling device. It's very easy to use. It's a all-metal construction pen with has adjustable depth for the microneedling. Minimal downtime because it's rechargeable and it can be used whether it's battery operated or not battery operated. If you run out of battery, you can go ahead and plug it back in. Interesting thing about the microneedling technology is that it's different than some of the other skin procedures out there, like the microdermabrasion or chemical peel or even the fractional laser procedures. We're actually removing parts of the skin, layers of the skin. Here, with this microneedling technology, you're actually driving punctures on the surface. So it's a very interesting technology, minimal downtime. The patients typically feel like they've had a sunburn after the procedure. Only lasts for about 24 hours, and then they can go ahead and normal activity. Our pen is, again, cordless and rechargeable. Very nice plug on the end where you can plug it directly into the wall. Heavy-duty construction, and again, variable depth. So the PRPen is, and all the other microneedling devices are Class 1 exempt devices. They do not require FDA 510K clearance. We are subject to the good manufacturing practices of the FDA, so we are registered with the FDA, but it does not require FDA approval or a 510K clearance. So here's a little bit more information. This is depicted in the quick guide that comes with the PRPen. You get the handset that has the depth guide right in the middle of the handset. Very easy to use. You can twist it to get the depth that you desire. And an on and off turn switch on the back. Again, easy to use. You don't have to push a button or anything like that. And then looking at image B, this is where the plug plugs in. So most of your operation is going to be used cordlessly, but if you were doing several patients back to back, you might run out of charge. Typically, charge lasts for about 4 hours on a full charge. But if you do run out of charge, say you forgot to charge it the night before, what have you, you can plug it in and still use the pen. So that's definitely a benefit for using our PRPen. The microneedling tips come with a 33 gauge needles. There are 12 of them, and they reciprocate in and out using a spring. It's a nice cartridge where it's self-contained. It does come sterile, and they are single use. So it doesn't communicate with the rest of the handset, so it makes it really easy to keep clean, and you don't want to cross-contaminate from one patient to another. Of course, you have the charger that comes with the indicator light. The light will either be red when it's charging or green when it's fully charged. So I got some noise here. Let me try to use the guy. Give me 1 second. I'm trying to. If you want to hit *6 on your line, you can mute your line. There you go. I've gone ahead and done that for you. So the charger has a green light when it's fully charged and red light when it's charging. So it's very easy to identify when it's fully charged. Again, the microneedling PRPen comes with a charger unit and 4 sterile tips just to get you started. The gauges of the needles are 33, and they can be adjusted anywhere from 0 to 2.5. The microneedling tips are single use and must be disposed of after each procedure. If you're doing a larger procedure, you might need to do multiple tips. They can get dull after using it for an extended period of time, but the typical face will only use one tip. The way you want to clean the PRPen after each procedure is with alcohol wipes. You don't want to submerge the pen in harsh chemicals or water. It is an electrical unit, so you want to make sure that you just wipe it with alcohol after the procedure. And that, because it's metal, it's quite robust. The PRPen comes partially charged. Once you buy it, you can open it and it'll be ready to use. But if it's not, you can easily plug it in, and about 4 hours later, it will be ready to use at a full charge. Again, it's designed to run continuously for 2 hours. We have had no problems with it overheating. We know that there are other pens in the market do tend to overheat, and that is after about 15 minutes. They tend to overheat. So ours does not, and we're very excited about that.
Okay.
Let me go ahead and mute some more people here. Okay. So some of the reasons why office would want to use the PRPen is that it can be combined with some other procedures that you're already doing. Say you're doing some injections of some sort, or maybe you're in cosmetic dentistry or you're doing a cosmetic procedure. It's very easy to add this onto your repertoire. It's not destructive procedure. It's more of a delivery mechanism. But what we have seen is that some of the benefits are it reduces the appearance of wrinkles, it minimizes discoloration, it tightens the skin, it minimizes the appearance of scar. We are also looking at follicle restoration. And reasons for you to use it is because it's minimal downtime. You don't have to really do a lot to prepare to do these procedures. It's ready when you are. It's also appealing for men and women because of the minimal downtime for them. They can resume normal activity in about 24 hours. It's, I think for some of the other major procedures for men, it's going to be more difficult to convince because they're going to have to stay out of circulation, if you will, for a period of time, maybe up to 30 days, where with this, within a 24-hour period, you're going to look like nothing has happened, but your benefits are going to continue to come about because you're delivering growth factors and collagens and different types of materials below the skin surface, and over time, the benefits are going to be seen. So it's also very easy to administer. It's something that either a physician can administer or any licensed practitioner can use. Again, compared to other technologies, chemical peels, microdermabrasion, fractional laser, that which are destructive of the skin surface, this does not destruct the skin surface. This is more of a delivery mechanism for biologics. Or if you were to use it with hyaluronic acid, just the needle punctures themselves actually stimulate collagen formation and growth factor release. Other things that you could use in conjunction with this are collagen injections or wrinkle fillers or Botox injections. Not to deliver them with the pen, but you could do them at the same time you're doing the PRPen procedure. So before we get into more information, I want to go through some safety information. Because it is a puncture, you should not repeat this more than every 2 weeks. Every 6 weeks is adequate for most patients who wish to keep their skin in optimal condition. If you're working on a scar, whether it be acne or surgical scar, 2-week intervals is pretty nice to repeat those procedures. For patients that are doing treatments with platelet-rich plasma, 3 times a year, 4-month intervals is optimal. But you know, it takes a commitment for the patient and for you to treat those patients. So some of the contraindications: we should not be using the microneedling device on active acne or aggravated rosacea. It may bring on an acne eruption. Do not perform microneedling on sunburn or any kind of inflamed skin. If there is skin cancer is concerned, obviously you don't want to be microneedling in that area. They need to see a dermatologist. Herpes lesions, if a person has a tendency to have herpes lesions, might consider an antiviral medication like acyclovir before you do the PRPen procedure. It should not be an active herpes breakout at that time. Anticoagulants don't really work great because you want that inflammatory response. So you might ask them to talk with their doctor to stop their anticoagulants. And the anticoagulants could make them bleed also more than you want them to. But other than that, they shouldn't stop any other medications. Steroids, again, if you want them to sort of, this brings on an inflammatory response, so you want to have them stop any type of anti-inflammatories before you treat them. If they have a bleeding disorder, obviously we wouldn't want them to do that during pregnancy or breastfeeding. Or Accutane, you want to wait 6 months after stopping Accutane before microneedling. So let's see here. The way that this happens, I'm going to walk through a procedure real quick. First things you need to have are your pen with the microneedling tip, cotton swabs. You want some type of applicator if you're going to be delivering hyaluronic acid or any other type of biologic. You need a cup to hold extra solution, and then you want your hyaluronic acid, preferably in a syringe so you can drip it on, and then whatever type of biologic you're using, if you choose to use a biologic, should be about 5 cc's and readily available. So it's recommended that you do topical anesthetic. Let that sit for about 20 to 30 minutes. You want to clean the skin before you apply that, and then once the anesthetic is taken into effect, you want to clean the skin after that. And be careful with the anesthetic around the eyes. It is an irritant to the eyes. You might want to give the patient some Kleenex, and then also stay away from the lash line. You want to do not apply within a centimeter of the lash line. So, after the anesthetic has taken effect, you go ahead and wipe the area, clean the area, get it ready for treatment. Chlorhexidine is a effective and recommended cleaner for the skin. So you don't want to use the microneedler dry. You typically want to use it with some type of lubricant, like a hyaluronic acid is a great solution, highly viscous material that actually helps, once it's delivered into the skin, helps with moisture retention. So I would think that would probably be one of the base, if you were to call it level 1 treatments. If you were to offer your patient, say it's just a PRPen with hyaluronic acid, and then you can get more advanced. You can offer with, we have some growth factor creams that we're going to be introducing in the next 30 days. You can get up the next step up, a couple extra dollars. And then on top of that, if they wanted more advanced treatment, you could use a PRP or maybe we also offer an amniotic membrane, micronized amniotic membrane technology that has growth factors and collagens, and it's been shown to really help with healing of wounds. So that's, obviously there are different levels of treatment that you can offer your patients. So anyway, to go back to it, hyaluronic acid, you want to lubricate the skin, hold the PRPen perpendicular to skin to ensure that the needle is flush. Don't hold it at an angle. And also, you don't really need to use any pressure. It really glides nicely over the skin. Don't stop in one spot too long unless you're focusing like on a scar, a hypertrophic scar or something like that. Don't go backwards and forwards. You just go in one direction. So go horizontal, vertical, and then diagonal. But between treatments, you probably want to add the reapply, whether it be the hyaluronic acid or the PRP or the growth factor cream. So when you talk about depth for needling, the forehead and the neck and the nose area, you're probably looking at anywhere from 0.25 to 0.75, depending on the thickness of the skin of the patient. When you're looking at the cheeks, a little bit thicker, so from 0.5 up to 2.0 for the thickness on the cheeks and the chin. So you can dial it up a little bit for that. Around the eyes, you have to be a little bit more careful. Don't do more than 2 passes and keep it about at 0.25 millimeters. Be very, very careful. It's very thin skin. And then on the upper lip, from 0.5 to 1.0. All this is actually available in a guide that we have available for all of our practitioners, so we can let you know so you can have that to reference. So after the first pass, apply your treatment solution and complete a second pass. So the treatment solution could be PRP, could be the growth factor cream, could be amniotic membrane. If you're using PRP, you might consider using in quadrants. So you apply the PRP, microneedle it in, and then move on to the next area because the PRP could dry out. You don't want it to dry out and lose its moisture. For the third pass, you can apply a little bit less product, but make sure you have, again, nice lubricated skin so you can pass the pen over it. And then you want to not wash the face immediately. You want to let them sit for a minute to let those materials soak into the skin. Maybe about 15 minutes, let them sit. Use only sterile water or saline to remove any blood. I would not use any soap or cytotoxic agents or any alcohol to whiten the skin after the treatment, because you want that material to be left on the skin and to resorb into the skin. So you want them to avoid sun exposure after the procedure, typically 24 to 48 hours. They shouldn't wash their face that night. They should be very careful. Alcohol, harsh scrubs, glycolic skin treatment should be avoided for 10 days. Makeup is not advised within the first 48 hours. Okay. This is a typical procedure here. This is somebody's neck getting done. You can see the liquid there is the hyaluronic acid and PRP mixture. That's why the coloration is there. And going in one direction and now going in another direction. See how quickly it's able to be done. Very nice, even, smooth strokes, and shouldn't take too long to do the procedure. Typically the last a whole treatment type is about an hour. So if you're microneedling a scar, it's a little bit different. You might want to focus on that area a little bit. You want to break up that scar. You want to disrupt the fibrous collagen tissue. and reinitiate that healing cascade. On the inflammatory phase, to come in and bring in those MMPs to break down that scar tissue. So again, you want to use topical anesthetic, and then apply the PRPen and the bioactive material, whether it's the growth factor cream, the PRP, or the amniotic membrane. Then should be done about every 2 weeks. And here's a scar. This scar was done from a facelift. A facelift scar. So a little bit more focal treatment here. You can see, wanting to break up that scar. It's a little bit, you want to make sure the patient's comfortable during the procedure, because you are focusing on one particular area. Post-treatment care, again, if you're using PRP, it's simply wipe the dry blood away with saline or sterile water. Do not use alcohol. Avoiding the sun is imperative. Sunscreen may be used. It's probably a good idea so they can minimize the exposure to sun. Otherwise, regular skincare can resume in 3 days. So this is what's happening when the PRPen treatments are occurring. Basically, the needling is penetrating the epidermis and getting into the interstitial dermis and triggering these fibroblasts to bring in the growth factors. These fibroblasts bring on the fibroblast growth factor, transforming growth factor beta, platelet-derived growth factor A and B. And so these growth factors start the healing cascade and actually help with collagen production and help heighten the skin, minimizing scar, minimizing wrinkles. So this is a little example that we did to show the delivery of particles or materials below the skin surface to prove that actually happened. So we took a simulated bioactive material, and which was a darker material, so we could see it, and we microneedled it in. So let's go ahead and show you a quick image here. So this is a swab taking the material. This is dry. We did this one example dry, but your patient obviously would have some hyaluronic acid at least on there. But here's the PRPen. You'll notice how quiet it is. It's actually a very quiet device because it's all metal construction. Not a lot of vibration going on. So it's very easy, and you can imagine the patients find it a lot more acceptable when it's quiet. So there, just a little bit of microneedling. Now, this is worst case scenario. So what we did, we took alcohol just to prove a point and to show that the material is below the skin surface. So we took the alcohol and we tried to wipe away the amniotic membrane with the cotton here, and you can see even after wiping with alcohol, there was material below the skin surface. So a really good visual aid to show that we are delivering materials with a pen below the skin surface. So we have some other helpful practice tips in this booklet. I'm not going to go through them, but I think it's a really good idea to read them before we do that. So some literature on some microneedling. We found some articles that show that, in hypertrophic burn scars, that percutaneous collagen induction aims to stimulate the collagen production by producing micro wounds, and it shows that platelets and eventually neutrophils release growth factors and help with the production of the intracellular matrix. So it did show that it does help reduce these hypertrophic burns scars over time. So another article was a percutaneous collagen induction therapy for treatment of scars, wrinkles, and skin laxity. And 480 patients were treated. There was a significant increase in patient satisfaction over 12 months. Histological analysis showed thickening in the epidermis without any evidence of injury or damage. Again, it's in contrast to the other ablative treatments. The epidermis remains intact, so it's very safe, whereas laser treatments or chemical peels cannot be performed in certain areas. You can do these in all different areas. And then this is for discoloration. What they did was they microneedled it into topical agents, and they found that the combination of the microneedling and the topical agent compared to just the topical agent alone had a reduction in the MASI score and luminosity index compared to the other side with just the serum alone. So clinical symptoms were significantly improved. So some of the other pens out there that you might have seen are the skin pen. There's been some pretty good press recently on the microneedling technologies. Skin pen is a similar technology. However, one major difference is...
Un seminar del pen.
Let me mute this real quick here. So one major difference between the skin pen and the PRPen is that this battery on the end needs to be unscrewed in order to be charged. The motor is also loose in there, so the motor can come out of the pen and fall to the ground when the back is off of it. So that battery, again, if it runs out, you have to unscrew it, screw it into a charger that plugs into the wall, and therefore you have no pen to use while the battery is charging. So it's not continuous use. Dermal pen is probably the biggest pen out there by name. Contrary to what you see on a lot of the images, it is not cordless. It does come corded, and so you are limited with mobility with it, and you have a potential of dragging that cord across the skin of the patient, which has contamination issues. Another thing is that it tends to overheat, and it does in about 15 minutes, and it does not operate if it's overheated. And the company knows this, and they have been offering a second pen for practices at a reduced price because of the overheating issues. So you actually, if you were to do an hour treatment, you'd have to have at least 2 pens and go back and forth between the pens in order to use it. It is a little bit more noisy. It is plastic construction. It's not a metal construction. It does have variable speeds, but that's not, we don't think that's a big benefit. And it does have different tips than ours. They're just a different head on them. And the price is about $3,000 for that pen. InnoPen is sort of a smaller player. Similar to the skin pen, again, you've got a battery that has to unscrew in order to be recharged. It has a different tip than everybody else, and their pricing to the practices are about $2,500. The Eclipse MicroPen is very similar to the PRPen. In fact, I think it's the same pen. It has a removable battery on the back. It needs to be removed to charge and cannot be used while plugged in, obviously. So other benefits that we are offering with the PRPen is the Youthful Skin program. We invested a lot in a brand called Youthful Skin, and PRPen is one of the featured techniques of Youthful Skin, but we're going to be growing more and more. Youthful Skin is a terrific direct-to-consumer branding that we're very excited about. We've already started with a website, and we'll be doing advertising and other marketing campaigns with the Youthful Skin brand. We're going to be adding creams and serums within the next 30 days. We're going to have a hyaluronic acid and a growth factor cream, which you can use during the treatment as well as use after treatment. So send them home with a bottle of the growth factor cream, collagen and growth factor cream, and they can buy that from you at your office, all under the Youthful Skin brand. We are looking to offer some customization with putting your office name on your materials, so that when they leave the office with the cream, it'll have your Youthful Skin cream. So that's within the next 30 days. We're just finalizing things right now with that. So in the future, we are going to have direct-to-consumer advertising and a physician locator on our website. It's not going to be a zip code locator. They're actually going to have to call in to get the doctor in the area. So what we're going to be doing is doing a first-come, first-serve type situation. So if your practice is the first in your area to buy the PRPen, you're going to be the first referral site that we offer our customers. So that's some initiative to go ahead and get started with the Youthful Skin program and the PRPen. We'll also have online testimonials that we'll be doing, and this is all at youthfulskin.com. Other things that we are working on in the next 30 to 60 days are PRP kits and machines. We have a really great technology that's being used in a lot of orthopedics and sports medicine clinics. Some of the leading clinics in the world are using our PRP kit machines, and we're going to be introducing that same technology into cosmetics. Now, this is not a test tube PRP kit. This is going to be a cartridge kit, so it's going to have really good concentrated PRP as opposed to just small fractions of blood. Also, micronized amniotic membrane. We are distributing this micronized amniotic membrane, which can be a treatment option for your patients. So the ordering information, here's customer service phone number. You can either call them or visit our youthfulskin.com website. We offer the handset. We have different options for the tips. You can buy a box of 20. You can buy a carton of 80. We're working on some applicators, so the tips will come with the applicators and the dishes already in the sterile packs. That is in the works. We should have that in the next 90 days or so. So at this point, I got one question: is how often do you have to repeat these procedures? Typically, repeat the procedure depending on what you're doing. Again, if it's a scar, you want to repeat the procedure about every 2 weeks, maybe 2 to 3 weeks. But if you're doing a regenerative medicine procedure, you probably would want to do it every 4 months or so. Okay, I'm going to go ahead and unmute these lines so that everybody can talk. Right, if anybody has any questions, feel free to ask me them at this time. Does anybody have any questions? No question? Okay. All right. Well, I appreciate your time for joining us today. We're very excited about this. We will be at the A4M meeting in Orlando in May. So if you are planning on joining us or going to the meeting, please look out for us at the meeting. We will be selling the pens on site there. But in the meantime, if you're interested in a pen, please call customer service or go to our website. Thank you very much.